The pandemic is still upon us, but in some places, the restrictions we've come to know are gone. States like Texas and Mississippi are dropping mask mandates and allowing full capacity indoor dining. South Carolina's governor also lifted executive orders requiring face coverings in government offices and restaurants, instead leaving it up to the administrators and restaurant operators to develop their own guidelines. Others like Alabama, Iowa, Montana, and North Dakota put expiration dates on their mask requirements. And in Michigan and Louisiana, officials eased restrictions and operating limits for bars, restaurants, and other businesses. In many cases, state health officials advise residents to continue following CDC recommendations. But the lack of regulation is raising concerns among restaurant owners, bartenders, servers, and even retail workers. One barista in Texas says she regularly deals with customers who walk out or bully her when asked to put a mask on. She now worries how she will be able to enforce mask coverings without a state mandate. Another restaurant employee is worried about his coworkers, especially those with pre-existing conditions who are at increased risk. The hospitality industry, however, appears to welcome the loosened restrictions. Business owners on the Mississippi Gulf Coast were glad Governor Tate Reeves decided to eliminate mask requirements and seating restrictions. And the Texas Retailers Association believe retailers know their customers best, though they add that many will continue to require workers, but not necessarily customers, to wear masks. Still, the National Retail Federation, which is the largest retail trade association in the U.S., issued a statement last week encouraging shoppers to continue to wear a mask. And some chains like Target and supermarket operator Albertsons plan to continue requiring them. That's in accordance with the guidelines public health officials have been releasing. They warned against lifting restrictions, saying despite increased vaccinations and a decline in cases and deaths, that lax measures could lead to a more lethal wave, pointing to a rise in new variants and the fact that the numbers remain high. I'm Tolly Anderson reporting.